Hello, everyone, and welcome to Joint Ventures, where we discuss important medical news from an orthopedic perspective. I'm your host for this episode, Dr. Jeffrey Carlson from Orthopedic and Spine Center, Newport News, Virginia. I'm an orthopedic surgeon with a focus on spine surgery. Today, we're looking into a microscopic menace that's quietly spreading through hospitals around the world, Candida auris. It's deadly, it's drug resistant, and it's not going away anytime soon. So what is Candida auris? Start with the basics. Candida auris, or C. auris, is a type of fungus. It's a yeast, to be specific, related to the same group of fungi that cause things like thrush or yeast infections. But C. auris is in a league of its own. First discovered in the ear of a patient in Japan in 2009, it's been on the medical radar for a little over a decade. But in that short time, it's managed to show up in 30 countries, and it's making itself right at home in hospitals and long-term care facilities. So what's the big deal? Aren't funguses everywhere? Don't we have medicine for that? True, funguses are all around us, but C. auris is one fungus that evolves quickly and can cause infection. It's what scientists call multi-drug resistant organism, meaning it can survive most antifungal treatments, and that makes it incredibly dangerous, especially for people with weakened immune systems. So why hospitals? Well, healthy people don't get infected with C. auris. But when C. auris thrives in environments where patients are vulnerable, like ICUs, it can be devastating. It spreads easily through contact. That could be through contaminated surfaces, medical equipment, or even the hands of healthcare workers. The problem is, it's really hard to kill. Most disinfectants don't work. Hospitals have to use specialized cleaning agents and protocols just to try to contain it. And even then, outbreaks still happen. In 2023 alone, the CDC reported a major uptick in cases of C. auris of 4,000 across the U.S. There was a jump of almost 580% 2019 to 2020, and the reduction of cases hasn't happened since then. Some hospitals have to isolate entire wings, clean with UV light, and even remove ceiling tiles to eradicate the source. So who's at risk? People who are already sick, cancer patients or transplant patients, premature babies. C. auris can be deadly, and infectious disease where the fungus enters the bloodstream can kill up to 1 in 3 infected patients. That's pretty scary. And because it's often misidentified as other fungus, it can be untreated for too long, giving it time to spread and get stronger. So how did this happen? How do we have a super fungus? Scientists don't have a definitive answer, but one factor may be the overall use of antifungal medications in agriculture and medicine. Just like antibiotic resistance in bacteria, fungi can evolve to survive. The good news, we're not totally defenseless. Some new antifungal drugs are in development, and hospitals are getting better at identifying and isolating C. auris cases early. The CDC has put out strict guidelines for containment, and some countries are experimenting with innovative cleaning technologies like hydrogen peroxide vapor and ozone machines. But this is a wake-up call. C. auris is part of a larger story, one where microbes are evolving faster than our medicines can keep up. It's a quiet epidemic, a ticking time bomb in our healthcare system. So what do we do? Awareness is powerful. The more people understand how these infections spread, the more pressure there is on healthcare systems to invest in cleaning, research, and proper training. If you or a loved one is in the hospital, don't be afraid to ask questions. Are staff washing their hands? What are the cleaning protocols? How are infections being tracked? Being informed is one of the best defenses we have. Secondly, choosing your hospital where you have surgery is very important. Sometimes patients are too sick or injured to choose which hospital you are admitted to, but with elective surgery, you will have that choice. Fortunately, at Orthopedic and Spine Center, we have been innovative in managing orthopedic surgery with outpatient procedures and don't require the hospital. We have been able to develop surgeries that are less invasive than older techniques, making the surgery and the recovery less painful. These outpatient procedures are done in an ambulatory surgery center, so the patients don't have to use the hospital. We like to say that hospitals are for sick patients, and our patients are not sick, which means our patients generally do not have significant medical problems that require hospitalization. You may have injuries or broken bones, disc herniations, pinched nerves, or arthritis that require surgery, but because your heart, lung, and kidneys are functioning well, you don't need to be in the hospital. The hospital takes care of sick patients, especially those with infections, so the risk of exposure is heightened. At an ambulatory surgery center, the patient population is not filled with those patients that have infections, so that greatly reduces the exposure risk. That's it for today's episode of Joint Ventures. Hope you learned something, or at least made you more aware. Make sure you subscribe and share it with a friend.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.